Here we go.
Hello, everyone. Thank you so much for joining us. Welcome to today's session of Maternal Health Mondays. Tonight, we will be discussing fibroids and PCOS. We have three amazing speakers with us tonight, so we are going to go ahead and get started. My name is Asia Rush, and I serve as a maternal health coordinator with Six Dimensions. And just to give you an overview of who we are, Six Dimensions is a Black woman owned public health agency, and our vision is to create a worldwide community where all community are holistically healthy. And we are committed to health equity and social justice as we work to create healthy communities. And a part of the ways that we do that is the Facebook Lives and to address maternal health issues. And the MMRC, which is a maternal mortality review committee, was created to combat these issues. Mississippi has one of the highest maternal mortality rates in Mississippi, and the maternal mortality reviews the death of women within 1 year of pregnancy. And to eliminate health disparities, the Facebook Lives were created, and we essentially use this as a space to educate and empower and raise awareness on maternal health disparities and increase maternal health overall. So, again, today our topic is PCOS and fibroids, and I'm going to give it over to Natoya as she gives us a little background on the topic.
Good evening, everyone. Thank you, Aisha. As Aisha said, my name is Natoya Sanders, and I serve as one of the maternal health coordinators for Six Dimensions. And I won't go into too much detail because I know we have our amazing speakers that are going to cover each of these topics this evening. But I think it is important to know, like Aisha said, that one of our aims is to make sure that we address issues that are impacting and affecting, women of color. And PCOS as well as fibroids disproportionately affect Black women. We don't often talk about it. Why? Maybe we feel like we just don't want anyone else to know, or we may feel like nobody else will understand what we're going through. But I think in our conversations, one major thing that we found out is that we don't talk about it because sometimes we don't even know that we are having these issues. We may have gotten so accustomed to maybe having heavy menstrual cycles during our teenage years, or just thinking that, oh, this is just the way things are. And so it may not be until we try to expand our family and we realize that, okay, there may be a few things going on here. So we just want to talk to you a little bit about it today. And I think one of the most important things to take away is, as women, we know our bodies, and we know if something feels off or if something feels different. And so don't ever be afraid, to speak up to your healthcare provider. And, it doesn't mean that you have to leave if you're having no symptoms, and go and ask. Something I would do would be like, can you run all these tests for me? But if, like I said, we know when something isn't right. We know when something feels off. And so we just want to empower each of you to talk openly and freely to your healthcare providers, because you get one life and we want to make sure that we take care of ours. So with that being said, I'm going to let Tierney introduce herself, and then we will get started for our conversation.
Good afternoon, everyone. I am Tierney Marshall, and I am an intern with Six Dimensions, and I've been here since January. And I'm glad to see you all here joining us. And I see the comments. Good evening to you all. And I have the privilege of introducing one of our speakers for tonight, Miss Renata Hughes. Renata Hughes has been in healthcare for over 10 years with experience in critical care, women's health, and primary care. She has also been a registered nurse for 4 years. Ms. Hughes is an active member of the Junior League of Jackson Nurse Practitioners in Women's Health and Sigma Theta Tau. She also serves on the Grants Committee for the Women's Foundation of Mississippi in Health and Racial Equity in Maternal Care Advisory Council of Six Dimensions. Renata currently serves as a clinical compliance manager for Coverage Partners in Access and Title V grantee for the state of Mississippi.
Thank you, Tierney.
I will go ahead and introduce our next speaker, which is Miss Kanisha Lewis. Kanisha Lewis is a registered travel nurse in labor and delivery. She's also my line sister. She has practiced as a registered nurse for a total of 6 years, with 1 year in medical surgical and the latter in labor and delivery. Kanisha holds 2 degrees, including a Bachelor of Science in Nursing from the University of Southern Mississippi and a Master of Science in Nursing from Clayton State University. After the completion of travel nursing, she has future plans to use her nurse practitioner degree to provide care that continues the advancement in education of women and infant services or enhance the beauty and confidence in patients undergoing dermatological treatments.
Okay, and I have the pleasure of introducing Miss Rachel Sprinkle. So, Rachel joined the Mississippi State Department of Health in 2019 as the Director of the Office of Rural Health and Primary Care. She is currently responsible for overseeing the management and administration of 7 rural health grant programs that work to help rural communities build productive healthcare delivery systems. Rachel is a graduate of the University of Mississippi. We will not hold that against you. With a BA in political science. She received her Juris Doctorate degree from Southern University Law Center in Baton Rouge, Louisiana. She then continued her studies at Loyola University, Chicago School of Law, and received a Master of Health Law. She has served as a member on numerous national, regional, state, and local boards, committees, and task forces. She has worked on various committees that address healthcare workforce, telehealth, diversity and equity, health aging, and rural health care issues. Rachel is a member of the Mississippi Bar Association, the Junior League of Jackson, and Delta Sigma Theta Sorority Incorporated. So thank you all, ladies, for joining us today. So we'll just dive right on into the discussion. Aisha, you want to start us off?
Yes, absolutely. So, ladies, you all have vastly different experiences and journeys. So, we're gonna hear from you first. We're gonna give you an opportunity to one, introduce yourself, and two, share a little about your journey. So, whoever wants to take the first, go at it. Go right ahead. The floor is open.
Alrighty, well, I guess I'll be the first one up to the stand. Hi, guys. My name is Kanisha Lewis. As previously stated, I'm a registered nurse. I've been practicing for 6 years now. Started off in med surg, and now for the latter 5 years, I've been practicing in labor and delivery. I'm 28 years old. About 2 years ago was when I found out about my diagnosis of PCOS. It was crazy because I was in nurse practitioner school and we were randomly assigned different assignments for different maternal situations. And I was picked to cover PCOS for my infographic. And it's crazy because several times, like with my visits with my OBGYN, I would tell her, like I missed a period, but the next month it came and it would only happen like once or twice a year. So she was like, well, you're pretty healthy. We haven't ran into any issues, so I think you're fine. So I thought, it was okay. So it wasn't until I got married and then I had an OB visit at that point. And when I was going over my assignment, I was like, I know that you said that all these things were fine. I can miss a period once or twice a year as long as there are no other issues and I'll be good. But then once I, studied on the diagnosis a little more, I went back to her and told her, like this total picture is like describing me. Like I have the facial hair, I'm missing periods. They never come like at the same time each month, or like it will go all together without having one at all. And then I didn't get the weight gain, but it was more so the facial hair and then like just random bouts of acne. Like my skin would never like experience acne the way that it did. So it's like it came all at once. And so she told me that she would put me on birth control before, but she took me off the birth control and she was like, I'll let you stay off for a couple of months and then you'll come back and then we'll do an ultrasound. So I came back a couple of months later for the ultrasound. And then when the results came back, she saw like my ovaries had like full of cysts everywhere, like all over my ovaries. So I was trying not to panic and break down. She was like, this is a diagnosis. It's not a life sentence. What I recommend now is for you to just do a basic lifestyle change. So she gave me recommendations to just incorporate moderate exercise into my lifestyle and then just try to eat healthy as much as I can. And she was like, if that doesn't work, for like 6 months to a year, you'll come back. And then at that point, we may, try alternate routes as far as like giving you medications that would probably stimulate your ovaries to release your egg. But luckily for me, I tried the lifestyle change and the with the eating healthy and working out. I would run like a mile a day. And then as far as my diet, I didn't do any bread and I didn't do any sweets. I drank only water for my beverage. And then it would just be like literally lean meats, fruits, and veggies. And for like 2.5 months, I went to the doctor and she was like, "You're pregnant." And I was like, "Wait, what? Like, it's true?" So it literally only took me 2.5 to 3 months. I really wasn't expecting it when we tried. I just knew it was going to be like over a year or more. But literally, the lifestyle change was all that it took for me. I know that everybody else's journey with PCOS is different because, depending on your weight or other issues that's going on, they may have to take the latter route of getting IVF treatments or medications to help stimulate ovulation. But for me, the lifestyle change was enough. And now I have a 1-year-old daughter.
Yes, thank you so much for sharing your story with us, Kanisha.
No problem.
So I will go ahead and go next. I'm Renata. I am a women's health nurse practitioner. I graduated last year from UAB. I am born and raised from Jackson, Mississippi, and I currently work with Converge. We are the operators of the Title 10 grant for the state of Mississippi. And just to kind of piggyback off of what Kanisha said, I don't have an experience with PCOS, but I also have a 1-year-old. And I found out when I was pregnant that I had a fibroid. I had no idea. And that just lets you know how everybody's body is so different. A lot of people experience like the heavy menstrual cycles. I didn't have any of that. Definitely like the cramping, but you think that's a normal thing, after so many years. And luckily for me, mine was small enough to where I didn't have to get it removed and it wasn't causing any major issues. So I'm really happy that we are having this conversation. Just because as women, I think a lot of times we can kind of downplay symptoms when it comes to us. So I think that bringing awareness to this is huge. PCOS and fibroids are a really big deal in the African American community. And we have the highest rates of both compared to every other race.
All right, I'll go ahead and go. Hello, everyone. My name is Rachel Sprinkle. As Natoya told you, I am the director for the Office of Rural Health and Primary Care currently at the Mississippi State Department of Health. I have essentially grown up spent all my life here in Brandon, Mississippi. And I was fortunate and blessed enough to meet the love of my life, Jake Sprinkle. We got married back in 2019. We essentially celebrated our first anniversary quarantine. So that was fun. Not too long after, we got married, we said we wanted to just enjoy a year, newlyweds, then before we decided to expand our family. We both know we wanted to have kids and, essentially grow our household and, take that path. But so it was about 2020. I decided to get off birth control. I'd essentially been on birth control since high school, just because I had irregular periods and it would be like bad cramping. But when I got off, we both told each other like we didn't want to put that kind of stress. It was like, let's just see what happens, whatever the Lord blesses us with. So based on my research, I did know that if we didn't get pregnant within a year, then that's when they tell you to seek your doctor, see if something's wrong. And it was getting close up to a year when it was just, very random and by chance. We were with my brother on vacation and I just remember laying in the bed and like I just was like rubbing my stomach or scratching my stomach and I was like, what is that? Like I felt like a bump and it was hard and I wasn't sure. Like I was asking my sister-in-law, I'm like, what do you think this is? She was like, I don't know. maybe it's fibroids, maybe you could be pregnant. She was like, maybe it's that. And it was just this whole thing. But I took pregnancy test, was negative. So then I went to my OB. And I told her, I was like, I just feel something really hard from like my belly button all the way down to my pelvic area. Like, this is just weird. I never noticed it before. And, you know, they did the ultrasound, and that's when she told me, she was like, well, you have fibroids. You have quite a few. She was like, I had probably about 9. The largest one was the size of a tennis ball. And I was completely like blown away. I was like, wait, what? I mean, I've heard about fibroids. I have friends who've experienced fibroids, you know, but it's definitely something different when it's you, and especially when it's you when you're trying to get pregnant and, you know, expand your family. And it was definitely a gut punch. You know, she told me my options. I told her, you know, we definitely were trying. And I had experienced like a heavy cycle once I got off birth control, but I just chopped it up to my body readjusting to being off of birth control. I didn't think anything different was it. I wasn't in any pain. There was no major difference to my body, my weight, demeanor, anything like that. I mean, I did feel more lethargic and just kind of something different, but I'm pretty sure like most people, I chopped it up to being the pandemic and just the toll it took on everybody, you know, being quarantined and whole like stresses of work and so forth. So I did seek a second opinion, because when she told me essentially, if you want to have kids, you'll probably have to have surgery, and it's not going to be an outpatient surgery because of how many and the size. So they're very fortunate enough to find a great fertility clinic, Dr. Hines, and we went to them. He did the same test. I was able to ask my questions, and he encouraged me to have the surgery, and had the surgery. And that was definitely scary. I think before then, the most severe surgery I had was like getting my wisdom teeth pulled. So here I am about to literally go under for over a couple of hours and spend multiple nights within the hospital. And yeah, the doctor came out. The surgery was a success. She came back. I asked her how it went. She was like, it went great. She was like, you had a lot of fibroids. I was like, yeah, no, you told me I had 9. She was like, when we got in there, we found you had 46. And I was like, oh, wow, okay. So that explains a lot. That's probably why I wasn't able to get pregnant. So it was, again, definitely a gut punch. But, you know, I had a great support system through it all. But I think what took the biggest toll on me was, like we've all said, like, you feel alone, and you're like, literally, I'm the only person going through this. I mean, all my friends, my line sisters, family, people you see on Facebook, it seems like everybody was like getting pregnant. And then it's like, wait a minute, why is this happening to me? Like, you never think it'll happen to you. For the longest, it was just like, why me? And then I had to realize, like, why not me? What would make me so special to where this wouldn't happen? But that doesn't mean essentially I've been condemned to like not ultimately have the family that I want. It's just that my journey is just going to look different than somebody else's. So again, just like Renata said, I definitely am very happy that y'all are having this discussion, because I think it's not being had. And for some reason, we as Black women, we feel that we have to carry literally the entire weight of the world and suffer in silence. And I just don't think that's fair. I don't think that's fair to us. I don't think anybody's asked that of us. So why do we put that on ourselves? So, and that was one thing I had to definitely get over as I went through that. But that's kind of what my journey has looked like so far in dealing with fibroids.
Wow, that's truly a story to tell. All 3 of you, again, unique journey. So thank you for sharing that with us. We can go into our next question, which we're gonna shift gears here a little bit. We kind of just want to hear from the medical professionals, Kanisha and Renata. Of course, Rachel, you can chime in whenever you like. But we want to get a medical perspective. So if you guys can talk about how is PCO diagnosed and how is it treated, although Kanisha, your story was a little different, we still just want to share some insight for those women who could have a different experience.
Sure. So actually, for PCOS, it's not a definitive test that's used to actually diagnose the condition. The bulk of the diagnosis is really based upon symptoms that you will report to your, provider, and you will just tell them the common symptoms that you're experiencing. Which most people that will say like my periods are irregular, or I have no periods at all. I'm gaining weight. I see facial hair that is unwanted, like it's on my chin, my facial hair along my chin, it's on my chest, it's on my neck, like it's weird. Or some people notice like their edges, around their edge line, that their hair is like balding, have balding areas of hair at their edges. You notice acne, but this acne is typically different than like normal acne because it's like it's called hormonal acne. So you'll notice the acne like appearing along your chin line. It may be on your chest, it may be on your back. And then once you tell your provider those symptoms, that should like stem them to like, okay, I'm thinking this is PCOS. So you don't have to have all the symptoms, and they don't have to do every single type of exam that would like lead them to that specific diagnosis. For instance, when I explained to my provider that only thing I had was the acne, the facial hair, and of course the irregular periods. And then the only thing she did from that point was an ultrasound. And so from the ultrasound, she saw that I had like buku cysts on my ovaries. Some people may do a pelvic exam. They'll like check for any like abnormal masses or anything. And they can also go to the extent of doing lab work, in which the lab work, it just tests like the testosterone in your blood, because PCOS, it alters, like, the ovaries are responsible for regulating hormones of progesterone and estrogen, but with PCOS, you have like an abnormal amount of testosterone in your blood too, which is like the male hormone. And that's why you get like the acne and all the excess hair, as if, like the men do. And then they can check your glucose levels, because PCOS also affects how your body uses the insulin and sugar in your body. So if those are high, that can lead them to the diagnosis as well. So really, a pelvic exam, checking your blood levels for the different hormones, and they can also do an ultrasound to actually visualize the cyst on your ovaries.
Thank you. Renata, is there anything you wanted to add or?
So, Kanisha definitely covered mostly everything. Like she said, it really is not just a definitive test when it comes to PCOS, but how she was saying that when they did the ultrasound, they saw a lot of cysts. That's kind of the telltale sign when it comes to PCOS. They refer to it as the string of pearls. Um, in school, that was one of the ways that, but other than that, like I said, she covered most things. And we already know it's more common in the African American community. It is also more common if someone in your family has PCOS, like your mom or a sibling. Um, and then I don't want to get ahead yet. I don't want to go into like the treatment.
You are absolutely fine. Yes, go right ahead.
Okay. So just to talk about the treatment options, like Kanisha, it really depends on the person. I'll say that first. It depends on the person, because some people can just do those lifestyle changes. Some people do have to get on birth control. It kind of helps with those menstrual irregularities. And then there are also some things you can do. How Kanisha was saying, if you have too much testosterone, you can take some androgen lowering medications. Um, it's called spirulactone, and it's basically like a diuretic. So there are different options, but they do try to push the lifestyle changes, such as weight loss, or if you're a smoker, to stop smoking. They say that if you just lose even 10 pounds, can have a huge difference in the level of symptoms.
So with that, Ms. Hughes, if you were diagnosed with PCOS, would you recommend seeing a fertility specialist before trying to conceive?
So I would say that if someone has PCOS and they're interested in starting a family, I would say definitely first try the lifestyle changes. But if you reach that year mark of not being able to get pregnant, definitely see a specialist because PCOS is the number one cause of infertility in women. So it can be a challenge for some people.
Yes, thank you, Renata. And I'm so glad the lifestyle changes work for you, Kanisha. You definitely are a true testament. Right, Rachel, I'm gonna direct this question over to you just because of your fibroids background. I know you explained how yours were diagnosed. Do you know what happens to fibroids during pregnancy if you don't get them removed?
From what essentially my doctors had informed me, and actually I have a couple of friends who were pregnant while they had fibroids and numerous ones too, that depending on the size and how many, it could essentially result in causing miscarriage. It could impact the growth of the baby. You know, they might not be able to reach their full weight or size because the fibroids are, I mean, they're essentially cramped in there with them and in that small space. So and also can obstruct, like impacting like blood flow, which could be a detriment to not only the, you know, the baby, but as well as the mom. But it definitely can cause, like, essentially has, depending on the size and how many, has to be continuously monitored, or it could result in you know, some potential damaging impact.
So, if there was, did you have any other symptoms? I know you said one day, you were laying down and you kind of felt, something hard on your abdomen. Was there anything else or any other signs besides, you and your husband trying to get pregnant? Anything that you can think of, like, oh, maybe that, contributed to, not contributed to, but, that was a symptom that maybe you didn't notice in the beginning?
Yeah, like I said, looking back, definitely having a heavy cycle, and it was, yeah, definitely heavier than usual. But like I said, I chopped that up to just coming off birth control. I also was kind of more, like I said, more tired, kind of lethargic, kind of. It's almost like a switch was slightly being flipped in, you know, mentally, even like things I wasn't interested in and I used to be really interested in about, or passionate about, just kind of like a blase. I was tired all the time, and you know, my appetite would just be so weird. And essentially, when I talked to my doctor, kind of running through these symptoms, they were like, yeah, that definitely could be a result, because especially of how many I had, it definitely had an impact on my hormones. And they were like, that definitely was probably causing you to be tired and just mentally and emotionally kind of feeling like not myself. Because honestly, as soon as, literally right after the surgery, I literally felt like my old self again, like physically and somewhat mentally. I'm like, oh, that's what was wrong with me. Like literally, it was almost like a switch. But I will say, it definitely not only took a physical toll on me going through that kind of surgery, but it did impact me mentally as well. I mean, just undergoing a serious surgery like that and the recovery itself. Um, and I definitely had to learn to give myself that grace of just, okay, yes, I know what I need to do to heal physically, but I also need to acknowledge that, like, I'm emotionally and mentally, like, going through something, and this is definitely, you know, making sure I take care of that as well.
Absolutely. And as you explain your symptoms, it could have been you could have thought it was a multitude of things because those are like the underlying symptoms for most uh conditions, you know. So I'm glad you definitely were able to advocate for yourself and be like, hey, I know something's wrong. So I'm going to pose this next question. We're going to shift gears a little bit. Can all of you discuss how your profession helped you throughout your journeys with fibroids and PCOS?
Well, I can say I'm very thankful that I was in nurse practitioner school at the time because I had been off birth control for like 6 years. like 5 to 6 years. And then I thought, just like Rachel said, I thought like being off the birth control, maybe this was my normal, that I would just skip a period every now and then. Like this is my new normal because my body has been so, used to and dependent on birth control for so long. This is just normal for me. And like even when I would, before I was in nursing school, I mean nurse practitioner school, I would mention it to my provider, but she even like, yeah, this is normal, like no big deal, it's normal. So I'm like, I'm good, I'm healthy, everything's all good. And like I'm just really thankful that PCOS was chosen for me to do my project on, because, had I not gotten that project, it probably would have been, way down on the line, because we had initially planned to wait about 3 years before we started to build our family, just travel, enjoy the marriage, and build our family later. But it's like once I did that assignment and completed, I'm like, no, I'm going back to her, because I just know, like, after reading this, all of this stuff fits me. Like, I have this. And so when I went back to her, I'm just thankful that, she heard me and actually took it upon herself to do the ultrasound to confirm that it indeed was PCOS. And like had I not known, I probably would not have done the lifestyle change, and that alone like opened up so many doors. And I'm like, okay, so I don't have to get medication, I don't have to get IVF treatment. And just like even though my journey was like for 3 months, like that 3 months felt like 3 years. And it's like when it happens to you, it's like, of course, I told my husband, I told my parents and like my closest friends, but you still kind of want to be like in a nutshell, like this is me and I have to go through this by myself. Because even though people know, it's like you don't really know until you're in those shoes. Like you feel like you have help, but at the same time you feel like you don't have any help. So it was like many like sleepless nights. What if what if I'm not able to have kids? Like, how's my husband gonna think of me and our marriage? It's like we're not able to build our family. It's like so many thoughts, and you just really feel alone, even though you do have a strong support system that's really, really wanting to reach out and help. But I say I'm just really grateful for the profession and me wanting to advance my career and everything, because had I not, I would not have found out about my diagnosis in the timing that I did. So I'm really grateful for that. And as far as like, working as a nurse at the time and everything, I would tell my coworkers, and a lot of them had, family members or close friends that have once been through the same thing. And just hearing their stories and like how they would make it out, or, like don't get too worried. There's always this option, there's always this. So it was just really helpful to have people with the same background and knowledge that could like give you that strength and that hope that you needed. Because your family, they're there for you, but they're not in the position or have the knowledge and background. So it's like, yeah, you can tell me this, but it was better sometimes to hear it from my coworkers, who had the same background too. So that's kind of like how it helped me in a sense.
Okay, so I would say being a nurse and a nurse practitioner has definitely just helped me in general. It has helped me be just more in tune with my own self and my body. I've learned a lot. I've seen a lot as a nurse. And so I would just say, sometimes depending on doctors, there are some great ones, there are some not so great ones. But just being in tune with yourself, you know what you know when something is off, you know when something does not feel right. And I would say that nursing has just really helped me kind of speak up when it comes to my own health, having that autonomy, not being scared to ask the doctor questions or to challenge them. I would say that probably has helped me the most. And then just being around patients and doctors, and sometimes seeing them have a full blown conversation about something, and the doctor walks out and they don't remember anything, or like they didn't digest anything that was said. I would just say that my profession has taught me more than anything to research, read, like learn for yourself. I mean, I hate to say don't believe the doctors. You can believe your doctor, but it is okay to check out things for yourself as well. Um, I would say that's probably the biggest thing that has helped me throughout.
For me, in my profession, honestly, the main thing that sticks out is just that I was able to have an amazing team, like my office and support system, because going through that surgery, I mean, they tell you the recovery time is 6 weeks. They were like at a minimum 4, but they were like, you're going to need 6 weeks of just nothing. And having, being a part of an office where, we're all women, all Black women, and them all literally rallying and being supportive of just like, please don't worry about work, whatever you need, take your time. It truly allowed for me to just give myself, being selfish and literally focusing on myself at that time to allow myself to heal both physically and mentally. Because I'm not gonna lie, when they first told me, I was like, you're gonna have to have surgery and it's gonna be like 6 weeks and you aren't gonna be able to really move or do anything. Like, I hate to admit, the first thought in my mind was like, oh my gosh, how is this gonna affect work? Like, how am I gonna tell my boss, like, I'm gonna have to check out for 4 to 6 weeks. We got all these grants and these programs and new people and it was all that. And then I had to just tell myself, like, stop. Like, literally, we as Black women were very guilty of doing that, of putting ourselves last, really suffering in silence, always wanting to sacrifice. And I knew what detriment this would cause to me, literally physically, if I didn't advocate and just be like, no, this is something I need to do, something I want to do, because I do want to be able to have kids. I want to expand our family, and this is what it would entail. So really just having, again, I just can never thank the ladies in office enough for really just being there, being supportive. And now that I've gone through this, it's given me an kind of like that extra boost or kick of passion to, further try to work with other program areas within the Department of Health when it comes to maternal child health and, Black maternal health and things like that with those offices as well.
Thank you all so much for sharing that. Rachel, you mentioned being selfish, and I think when it comes to our health, we have every right, to be selfish. And oftentimes we're all guilty of it. Our first mind goes to work or who's going to take care of this, who's going to take care of that. But then we can be slowing, our own healing, trying to kind of bounce back into things. And again, we were talking about listening to our bodies, and our bodies also tells us when it's time to slow down. We don't always listen, but they do tell us, when we need to slow down. So, we just thank each of you for sharing your experiences. And as we begin to wrap up, we're kind of going to loop 2 questions into one and give each of you an opportunity to answer. So we do want viewers to know, and we'll probably drop these in the chat as well, just if there are any type of resources, that helped you during your journey. Sometimes there are certain books or, Rachel, you mentioned certain fertility clinics or certain doctors, anything that you would like to share that helped you along your journey. And then as we close out, just maybe what piece of advice you would give Black women along this journey.
Well, me personally, since my journey was just short of like 2.5 to 3 months, I didn't really have the time to, like solely depend on other resources. But since I was recommended to do the lifestyle changes, I did just do like a basic Google search and found out that with PCOS, most people respond with lifestyle changes if they adhere to like a low carb, low fat, and like low sugar diet. So it's almost kind of like with PCOS, you have to treat your diet as if you have diabetes because with it, like your body, like sometimes with people have insulin resistance with PCOS, so your body doesn't use insulin in the way that it should, and it can have you with elevated sugars. So I just eliminated, I ate fruit, which was the good sweets, but as far as like other type of desserts, I eliminated that from my diet, and then just ate lean meats and veggies, and then I stuck with the moderate exercise. I didn't do anything strenuous. I just did a light jog and mixed with a run for like a mile a day. So it doesn't have to be like a total switch where you feel like you have to like flip your whole life around. Like I'm not used to exercise and I just have to go hard, blah blah blah. I literally just ran a mile and that was it. And if you incorporate that routine with exercising and then stick to the low carb, low fat, low sweet diet, I mean that's what works for me. And then just understand that your journey doesn't have to be like a mere reflection of someone else's. The lifestyle changes may not work for you. And in that case, you would just go back to your provider and say, look, I've tried this for 6 to 12 months. I haven't had any luck with getting pregnant or whatever your desire is with how you managing your PCOS. And then from that point, they would just know that they may have to put you on certain medications to boost your ovulation or anything like that. So with me, strictly just adhering to a diabetic diet that worked for me.
So resources wise, honestly, I'm kind of like Kanisha. I do Google a lot, even though I am a healthcare professional. But I do try to go to like evidence-based articles, like a legit website. So I know like the National Institute of Health, they definitely have great information on their website about a ton of different things. As far as advice that I would give, whether a person is experiencing PCOS or fibroids, I would just say be present in the moment. Ask questions. Don't be afraid to get a second opinion. Don't be afraid to ask questions. I think that's just the biggest thing. And like I said, just doing the research yourself, just kind of read up. Even if you go through several different articles, you can look at the similarities and the difference in them. Yeah.
And to piggyback off research, is definitely a good idea to do research on your own because your provider can tell you this and tell you that, but you want to be able to have a comeback for them when they recommend certain things for you. Like they may just say, "Oh, nod the hair, that's fine, you'll be all right," or blah blah blah. And you can say, "No, I've been doing my consistent research for this amount of time, and my research tells me blase, and like this is what's going on with my body." And if you don't get the response that you need from a certain provider, you have every right to move on to another provider that would give you, the desired effort that you need. So definitely do your research.
For me, like I had previously mentioned, with the resources, we were able to, find a great fertility clinic, the Mississippi Reproductive Medicine. They are located in off Lakeland Drive in Flowood, and they were essentially very helpful. Again, I wanted a second opinion because they were talking about this major surgery. That's what my OB recommended as one of the options. She gave me other options, but she was like, if you're immediately trying to have kids, you're going to probably have to have the surgery. And they provided me at the fertility clinic all this information, visuals, because I'm a very visual person. They showed me kind of how things looked, process, literally walked me through. Everybody was super nice and was always, anytime I had questions on call, I could call them anytime, message them anytime. Again, they were very attentive to me and listened to any concerns or fears that I had. And, like Kanisha and Renata said, I also did my own research because they were throwing out all these big words and medical diagnoses. And I was like, okay, I need to go home and hit Google because I need to really break it down so I can understand what they're saying. So it's not going completely over my head because it can be very overwhelming. Like sitting there, especially you're already nervous and tense when you go to a doctor's office, but when they're throwing this kind of information at you, it can definitely, kind of be a shock to the system. But, they were great. So what I would recommend, as far as advice to women, definitely listen to your bodies. Definitely do not put your health last or second. I know we tend to do that because we brush things off, but you never know. Let a healthcare professional diagnose you, get a second opinion, and truly take that time to put yourself first, whether you do have to have surgery or you don't. And also don't forget the mental and emotional aspect of it too. While physically this definitely takes its toll on us, extend yourself that grace to know that I'm probably like an emotional wreck or having going through anxiety and depression, and that's not taboo. There's nothing, that's not a bad word. There's nothing wrong. And that's one thing I had to learn, that it's okay to not be okay. It's just acknowledging it and managing it and getting the help you need. So I just encourage everybody to not only prioritize your physical health, but also understand that this could possibly take its mental and emotional toll too. So it's okay to get help for that as well.
Thank you, ladies, so much for your responses and the information that you're giving. We're going to switch over to the chat. If there are any questions that any of the viewers would have, can you please just put them in the chat? And while they're doing that, I just wanted to share something. When you all were talking, I was thinking about my own experiences and my mother. So I'm my mother's rainbow baby. She had her own struggles with fibroids with when she had my sister, and I'm her rainbow baby. Before I was born, she went to the doctor, and he was telling her to consider having a hysterectomy to begin looking at her options because of her struggles with fibroids. And a nurse, a woman, she pulled my mother to the side and told her, I don't think you should do that. And then I was born. So and to this day my mother still hasn't had to have a hysterectomy. So whatever the doctor had going on. But I wanted to say that to share that if you're struggling trying to get pregnant, or you're thinking, or you're losing hope, just don't lose hope. When it's time, it'll happen for you. Are there
Thank you,
anything
Tierney.
else?
I received that on so many different levels. And so thank you, Tierney. I'm glad you're here.
Yes. Do we have any
And
questions?
it's a full circle moment because now I work in maternal health, talking
Right.
about
It's meant
so
to be.
right.
Advocating for yourself.
So, do we have any questions in the chat?
It doesn't look like we have any questions, but I do see a statement that I want to share that one of the viewers shared with us. Jasmine McNair stated that I recently found out that I have a fibroid as well. I asked my OB to be checked for endometriosis, and that's when I found out about the fibroid. So definitely advocating yourself while you're at the doctor's office. If you feel like anything's wrong, any symptoms that you have, whether they're minor, whether they're major, still express it. You have that right to know. And like Toya said, like we've been expressing in this the live, your body. Your body speaks to you in so many different ways. So definitely listening to it. If you're experiencing any type of symptoms, whether they're PCOS or fibroids related or any medical condition related, this topic was on fibroids and PCOS, but we've covered so many different topics, whether it's maternal health, whether it's mental health, whether it's prioritizing your self-care. It's just so many factors. I don't believe there's any questions in the chat.
I think I one last
okay,
comment.
go ahead. Yes.
I was gonna say, just to kind of piggyback off what you said, Aisha, like we have to remind ourselves that we don't have to struggle for a certain amount of time before we bring this, attention or this matter to a physician, or before we decide to go an alternate route or to seek help. A lot of times we're like, okay, well, if I hadn't done this by, the time I turn 35, then I'll see. Well, we don't know what challenges we're going to run into when we hit that, So I guess I said all that to say, even with my personal journey, I had to reframe my thinking, like Rachel said, and just kind of like, you know what? I don't have to suffer. If there's another route, that I want to take, or, whatever it looks like, we can do what's best for us. And I think that's the, main thing going forward, is that this is our life. These are our bodies. They're important decisions that we're making. And we have the right to be selfish, do what works for us, do what's best for us. And we do not have to suffer. So does anybody else have anything to add?
I'll just lastly add, to kind of piggyback off what you said, Toya, on top of not suffering, but not letting that guilt weigh you down and make you apprehensive from wanting to take the initial steps, to get the help you needed. Because that was another thing I struggled with, the guilt of, should I have started to try to have kids earlier? Or was it because I did this growing up? Was it because I was eating this, or that my diet, or was it because of something I did X amount of months or years ago? Is that the, you just literally create these things in your head and this guilt and like, oh, what if I can't have kids? How's that going to impact my marriage? And, what if this happened? Just all of that. And you literally kind of have to, while those voices do not go away, you definitely have to learn to turn the volume all the way down and not let that dictate or define how you want to go about making the best decisions for you.
Anybody else have any comments?
Sandra Green in the chat says, "Good evening, ladies. Why is it that the African American women has this issue the most, other than our Black girl magic abilities? So why is it more? I think she's saying is, why is it more common in us?"
Renata, do you have any answers from that from a
So,
healthcare perspective?
so from research that I have seen, specifically when it comes to PCOS, the reason that I thought that it was more common in African American women was because of obesity, and then like other socioeconomic factors, but it really was nothing just specific. And then when it comes to fibroids, pretty much like the same information, but in the past we have heard that they think relaxers have, an impact on fibroids. I don't know exactly how true that is, but there are some articles out there where studies was done, and it showed that most of those women that had like a relaxer within the past year, pretty much all of them had fibroids. So that may be, but I'm not sure if there are any recent studies on it.
And just kind of looking looking at evidence-based articles, as you said earlier, I think a lot of, we look at it and we're like, gosh, are Black women always disproportionately affected, in the healthcare field? And I think a lot of that is tied back to, we know when it comes to maternal health that racism plays a huge factor. But I think also we fail to realize sometimes stress, and Black women tend to have lower, I was reading it said lower vitamin D levels. So, obesity, our stress levels, lower levels of vitamin D. Oftentimes we start our cycles earlier. And it said, of course, there is no definitive answer, like you said. But it's interesting when you look at the research, and you try to kind of link these things together. And I guess, if we had an answer, it'd be probably a, $1 million answer to this question, because I often wonder, like, okay, does everything, disproportionately affect us? But I think that's also when we have to look at underlying issues too, not just within us, but within the system as a whole.
And just to piggyback off of that, I think another issue is too, like sometimes as Black women, we may see some of these symptoms like in our earlier childhood, but it's like when we go to the OB to explain these issues, I feel like the first thing they'll do is just say, we're just going to put you on birth control. And then, like, you've been on the birth control in high school, all the way up into college and beyond. And then now you're married and you're, discussing with your partner that you're wanting to build a family, and then now you realize that this birth control that you've been on for all these years have really masked the issue, and now that you're off, you're just now saying, oh, so when I had all this bleeding, or when I didn't have, periods occurring in regular intervals, this was really an issue, not something that, just throw me on birth control without getting down to the ground root cause of what was going on with my body. And then for some people, you're at a point where it could have been caught if they would have, did with the tests and things that they needed to do to diagnose you. Or, some people it's probably too late in the game, and it's like, I'm stuck with this issue and now it's affecting how I go about with, building a family and everything with my future. So I think sometimes birth control is the issue too, because it's like the first line thing that they do for every type of OB issue. Just put it on there and it just masks everything that has been going on with your body all these years.
We have another comment in the chat says no. This is from Deandra Felton. She says no questions. I do want to share that I was diagnosed with PCOS about 4 years ago with no other answers as to why I was experiencing what I was experiencing. I was told up until then that I probably would not have children without medical intervention. At 5 months, I found out I was pregnant naturally, and I'm now 7 months pregnant.
That just goes to show we just never know. We just have to continue to stay in tune with our bodies and take care of ourselves as best we can. So congratulations.
Congratulations, and we wish you a healthy pregnancy and a beautiful delivery.
Absolutely. And again, thank you, Kanisha, Renata, and Rachel. We really appreciate you guys for sharing our story. Sharing your stories with us. We will have a next Facebook Live. That'll be August 29th. It will be during Black Breastfeeding Week. So be on the lookout for the flyer for that. And again, thank you guys so much for joining. Have a great night.
Thank you all.
Thank you, guys.